Thank you very much. Well, thank you for having us here. I'd like to thank Janet for inviting us, to Dr. Daniel Ford, Vice Dean for Clinical Investigation, for his vision to establish a ClinicalTrials.gov program, and for Dr. Carducci to have specialized resources within the Kimmel Center to provide the resources to decrease the burden to your faculty. So what I'm going to do is give you a quick overview of ClinicalTrials.gov, and then we're going to present some exciting news on the compliance front with Dr. Laji. So before we get started, I want to make sure everybody's on the same page. There is ClinicalTrials.gov, which is a public site that anyone in the world can go to and look at the compliance. And then there's the PRS system, which you have to have a university-specified login to actually access. Our team has access to every study that Hopkins has, and there's nearly 500 studies registered in the Kimmel system currently. So I wanted to talk about why this is necessary. And of course, we start with the patients. Patients literally give their blood, sweat, and tears into clinical investigations. So we want to make sure that we're honoring the commitment to provide the resources and results at the end of the study. Current research shows that about 60% of NIH-funded trials actually make it to results reporting at 1 year. We're trying to drastically improve that here at Hopkins. The next is scientific validity and transparency. We want people to know what we're doing. We want to know about the great research that's being done here, both as a recruitment tool and also to let people know the results of the research that's being done here. There are ethical considerations as well as responsible stewardship of federal funds. I was looking at grants.gov just yesterday, and you may not be surprised that Hopkins led the nation in the number of grants received as well as the amount of grant funding. Last year, fiscal year 2018, over $600 million was given to Johns Hopkins to conduct clinical research. And I would venture to say that all of us are interested in making sure that stewardship that's entrusted to us actually pays forward in the sense of reporting the results of that research to the general public. It's also important to the IRB. No sense repeating a study that's already been done. You can't really assess that unless all the research being done, both successful and non-successful studies, is actually available. Also, if you plan to publish any of your research, we have an increasing number of frustration with faculty where ICMJ journals, some of the top journals in the world, are no longer looking at your manuscripts because there are some compliance issues with either the registration or updating in the system. We don't want that to happen to anybody here, so make sure that you're registering your study, and the timeline for that is before you start enrolling. So if you plan to start enrolling, make sure, work with your research team to make sure that your study is in fact registered on ClinicalTrials.gov. You should have an NCT number before you start enrolling any participants. Also, it's the law, so you have to do that. And if you have any funding from NCI, which I imagine most of you in this room do, it's actually a requirement in the terms and condition of your award. It's also required if you have Medicare or Medicaid services by the World Health Organizations, and also the grantors that sign on, including most recently the Bill and Melinda Gates Foundation. So if you are receiving funding to conduct your research, take a look at the terms and condition and make sure that registration and results reporting is a requirement. So a quick one-slide overview of where we are. This all started back in 1997, and then the following year, in 2000, the website was actually released. Some very key events happened, including in 2016, the long-awaited final rule came out. They gave us till January to make it effective, and then only till April to actually be compliant. The final rule greatly expanded the number of studies that had to be registered and results reported, and the criteria and the scope of that registration and results reporting. It also expanded the timelines and gave some concrete timelines for when your updates were due and when you had to respond to comments. So in view of that new final rule, we actually created and expanded our program. So what specifically was involved in the final rule? Well, it only applies to applicable clinical trials, and there's some criteria to help you determine that. This is mainly the studies you think of with drugs and biologics. We want people to make sure that these studies are registered and the results are reported for this research. But even if it's not under the purview of FDA, if you're receiving any NIH funding to do a clinical trial, and yes, the definition for clinical trial is a little bit in flux. You may have seen some press releases about what the NIH considers a clinical trial. Just know that it's a little bit broader than the definition that FDA gives of an applicable clinical trial. This definition is much broader and includes many things that you wouldn't expect, including behavioral research. So keep in mind this definition, although technically hasn't changed since 2014, is being more broadly applied when it comes to what trials must register and report results. And there are some associated penalties. You may be aware that there's a monetary fine that can be inflicted by FDA. The fine is $11,000 per day per study, and since it takes quite a while to get these studies updated, that fine could grow exponentially. A watchdog group out of the UK has estimated, based on the latest numbers I saw on Friday, that if FDA had actually imposed the amount of fines to institutions just since the beginning of this year, anybody want to take a guess about how many millions of dollars FDA could have gathered? No? What's that? Hundreds. $620 million. So this is a website that's available for anybody to see, and it just shows the increasing political and social pressure on institutions to make sure they're reporting the results. Now they're actually putting a dollar amount into how much FDA could have fined, putting pressure on them to, in fact, enforce the rules that are already in place. In addition, if you look at the terms and conditions of an NIH award, NIH can actually, if you look at the language there, can actually withhold some of the funds of awards. Now, if there are milestones set up, some of the milestones, even in PCORI and the VA studies, actually have ClinicalTrials.gov listed as a milestone. So if you fail to accurately update or report the results, you actually lose out on one of the payments associated with that trial. I can tell you from the PRS side and being a part of a national task force that NIH is making significant strides to associate your funding with your NCT number to make sure that you're in fact up to date. And when Dr. Collins came here to, actually this is a viewpoint that he published in JAMA at the time with the continuing review, where he's threatening to withhold the funding to institutions at an institutional level. So we definitely don't want to jeopardize your individual funding, and certainly don't want to jeopardize the funding here at Hopkins. Also, there is a national registry, and recently the Bill and Melinda Gates Foundation signed on. There's a lot of pressure to make sure that everything is actually registered and reported online. And again, if you're using anything with CMS, you must register and report your results. Now, we have had specific individuals, some in the Cancer Center, that have not been able to have ICMJE journals actually look at their manuscript. It's just been turned down before it actually was sent out for peer review because the investigator did not register the study prior to enrollment of participants. We don't want that to happen to you, so please use our services through the program. So as a quick review, FDA and NIH require that your study is registered within 21 days of enrollment of the participants, and their associated penalties, including criminal proceedings for the submission of false or misleading information, and then certainly the penalty of a loss of grant funding. And on the CMS side, if there are any services that are covered by Medicare or Medicaid, you must report the study in ClinicalTrials.gov. Okay? So that all brought us to the point where we felt we needed to create a program to align with that. And we have 3 full-time people here. We have Dr. Lauji, Dr. Nuama, and Dr. Teta, who are working full-time in this world. We have 1,000 studies in the School of Medicine, School of Nursing, and nearly 500 studies in the Sidney Kimball Center. So recently, in April, we made a very fortuitous hire by bringing Dr. Lauji on, and I'll introduce her now to talk about the great work she's doing in the center.
Good afternoon, everyone. Thanks for having us. So I started in April with Sidney Kimmel, and basically Dr. Carducci thought it was a good idea to bring the program to help improve our compliance. What I'm doing is I'm specifically focusing on only the SKCC records, and with Janet and Deb, we kind of discussed the situation and decided that it would be best to approach this program by program. So basically, what I've been doing since April is meeting with each program with their study team. Normally it's like the research managers, the research nurse, the coordinators, whoever has been responsible for putting these results together, and putting together a list of all the problem records that are in the system, and then addressing each of those records. We start with the late records, the most non-compliant, and work our way forwards. I've also been, not only through the program, but as with the whole Cancer Center as a whole, as people are registering their new studies or entering results or updating the records, anyone who needs assistance, I provide that assistance to them and the group. Last week we also held some training sessions to the research staff. I'm not sure how many of you are aware of that, but basically we trained, I would say, approximately 40 research staff, this was last week alone, on how to register, how to report results, how to use the PRS, and Many of those had been ones that this is a new part of their role. They never had to use ClinicalTrials.gov before, so they have been educated on the system. And some have been ones that have used it but not as often, and now they do need to comply. So they are learning how to use the system and make it more efficient. Obviously, this is all towards more prospective compliance. Sorry. So I'll start off by things that we do. So basically, we're focusing on making sure all the studies that need to be registered are registered. So that includes creating the accounts, maintaining the accounts, making sure that the studies that do need to be registered are identified correctly and the team is aware that they need to register. What happens when you do register or when you do submit your results, your record gets sent to the PRS reviewers. So these are the reviewers from ClinicalTrials.gov office that review the record, make sure it's accurate. So when it goes to them, they'll come back with comments sometimes. So I work with the team to address those comments, and usually there's a deadline for that, so to make sure that they're addressed correctly. Also, we want to make sure that the records are verified every year. This hasn't been happening very often, or I guess not throughout the whole cancer center, so I try to make sure to remind the team when it's time for them to verify their records. We're also trying to work with consolidating the PIs that are listed, because a lot of times PIs have left institutions, and yes, it gets updated in IRB and at the institutional level, but not necessarily in ClinicalTrials.gov, so we're trying to make sure that those are in sync. And then there's the results side. So with the results, even though the due date is within 1 year of the primary completion date, if results are not reported in time, they become late. And the way ClinicalTrials.gov works is if your results are due in June, we've noticed that the average review cycle can take up to 80 days. So if you submit your results in June because it's due in June, that review cycle might take 80 days and your study could become late within that review time. So the plan is to notify the team that maybe 3-4 months in advance that your results are due soon. Please either update your record or start submitting entering your results. So hopefully we can improve compliance that way as well. So I do provide assistance on not interpreting results, but interpreting publications when some of these records are retrospective we're catching up on. So I do provide the team assistance with that, comments that come back. So once you submit the results, that's not it. They do come back with comments, and we do have to address them, just like when you're submitting a manuscript and they come back, the reviewers come back with comments. And the same thing, updating study status. Now, we do have direct services, so it's $50 per hour. We haven't really gone into that with the Cancer Center yet, but that is optional in very extraneous circumstances. And just be aware that when you are submitting for your grants, NIH does allow up to $2,000 of direct cost for ClinicalTrials.gov results reporting. I guess it's results and registration. It's anything towards ClinicalTrials.gov. And it's an allowable expense, and it also makes your grant more competitive rather than the opposite, because they're seeing that you are working to stay compliant. So we also make sure that with CRMS and IRB that everything kind of cooperates, but to make sure that everything matches. So sometimes what happens is the study is expired in IRB, but it's still active in ClinicalTrials.gov because it hasn't been updated. So we want to make sure that's there. Terminated studies are clearly identified as terminated in ClinicalTrials.gov. Again, the changes in the PI, enrollment status, we want to make sure that studies that aren't registered have not started enrolling, or vice versa. And also making sure that the study sites are correctly identified, because if the public is looking at these studies, especially for active ones, if they don't see all the sites that are available to enroll, then it's counterintuitive, especially for recruitment. So for those of you who have heard from me by email, and for those of you who have not, basically we have a communication trail. So what we're doing is, if there if a record needs attention, I first contact the record owner, and it seems like at the Cancer Center, the record owner is usually the coordinator or the research manager, or in some cases the nurse, but it's someone who is directly involved with the study and is updating these records. And I CC the access list members, and CCRO is always CC'd. If I don't hear anything back, then I'll add on the program manager if they weren't already on that list. And then it's you guys, so the PIs that get added on. Unless you've specifically told me that I want to be CC'd from day one, and then that's fine. But we basically try and follow this. So far I haven't had to go up to the third reminder. I usually hear back by the first or second, and then we work together and try and finish the record and make sure it gets submitted correctly. So this is kind of like an overview of what we've done so far since April. So you can see in the orange, that's the number of late records we had. So when I started in April, we had 78 late results. Today we're sitting at 38. So this is, actually today it's 36. So this was when I did it last week. But we're trying to make progress. So we're definitely bringing down the number of problem records and new problems. Late results take a lot longer because sometimes these are older records. The PI is gone, the study team is no longer here, we don't know where the data is, and we're doing a lot of digging to find out where it is, or we're going through old publications and trying to get the data from there. Sometimes the records, the way they were entered 4 or 5 years ago, are not the way they should be entered now, so we have to make sure that everything is compliant with today's guidelines. So it is taking time, but as you can see here, we are progressing. And the plan is hopefully that we can get everyone used to the system so that we don't get into this spot where we have to catch up and we can just work prospectively. And that's all I have. Does anyone have any questions regarding our program? Yeah.
Just say a word about there's a little bit of a misunderstanding about what is to be reported online in ClinicalTrials.gov compared to what may have been published in the one definitive papers that the PI published about that specific study.
Mm-hmm. So when you first register your study, you have to specify all your outcome measures. So especially the primary outcome and then any secondary outcomes. And then if you had any exploratory outcomes, those would be like your other specified outcomes. Now, when they say that your results are due within 1 year of the primary completion date, so that's when you have the outcome of the primary outcome measure. And then the other outcomes are due within 1 year of the study completion date. Any outcomes that you've listed that are in your protocol that has been registered, you have to report those results. And they want the raw data, not the statistical analysis. So you can't, you have the option of putting in your statistical analysis, but you need to put in the raw data. And it would be whatever is specified in your outcome measure. Now, they do have a certain phraseology, a certain language that they want you to use when you're putting in. It'll take me a while to go through that, but there is a certain language that they would like you to use, a certain syntax when you're putting in your outcome measure descriptions, the title, things like that. But the results itself is going to be the actual data.
And the secondary exploratory endpoints, if they are still in the process of being performed?
Yeah, then your completion date would be whenever you're planned to have it done. So that's why it's important to make sure the record stays updated, because you can always update your completion dates accordingly. So if you know that we put into 2018, but it's actually not going to be till 2019, then go ahead and update that in the record. Mm-hmm. Anyone else? Okay. Thank you very much for your time. Thanks.
All right, as you've heard, this is very important on two accounts. Those of you who watched Vice President Biden when he was still in office go through the types of things that they felt were very important. One of them, Greg Simon, who he had recruited to head up the Biden initiative, remarked that in the world of cancer clinical trials, if I wanted to go find as a patient where there was a clinical trial open, the last place I would go to is ClinicalTrials.gov because it was basically useless. That was the argument. And I think everyone's nodding because it was. And so one of these is trying to get everything up to date so it's no longer useless to the general public. That's a service that we have to provide. The other one, you can see the little mission creep that snuck in, is that there has been back and forth on the political side a lot of arguments about the lack of publication of negative data and about other things that people sit on. And the arguments, and I can remember when Senator Shelby from Alabama led a charge in this space, saying, you remember this, he's saying, we paid for it. The United States of America paid for your study and you have not published it and you seem like you're not going to. It's been 10 years. Just because it didn't work, we need to know that it didn't work. That'll help us move forward. So some of this is related to that. They got to capture the data. Thank you for taking this on. It's a lot of work, and hopefully when we get caught up, we will invite you back when we're all caught up so you can smile and enjoy the glow of success that you're already headed toward.